All righty, welcome, my friends, to another episode here of Extreme Health Radio. Got a really cool show for you today. We're going to be talking with Dr. Darin Ingels, who's our doctor. And by the way, it's our doctor for Kate and myself, and really great guy. We're going to be talking about him, about Lyme disease, and some solutions in his book, The Lyme Solution. So we'll be introducing him in just a second. Let me just give you a brief rundown of what we have going on here at Extreme Health Radio. Lots of cool stuff coming up. Let me bring this on the actual website itself, or the video, so you can take a look at our upcoming guests. Today we got Dr. Darin Ingels, and on Friday we got Dr. William Pollack. We'll be talking with him about PEMF therapy for health, and that should be a really great show with Dr. William Pollack. And then on Monday we got kind of a double header. We have Amy Prohl, and we'll be talking with her about the microbiome and its role in chronic inflammatory diseases. And we'll talk a little bit about the Marshall Protocol, which she is somewhat of an expert in, Dr. Trevor Marshall down in Australia. And then also we're going to have Mark Wolin on, and we're going to be talking about family constellation therapy on Monday as well. The next Wednesday, we got Yarrow, I love that name, Yarrow Willard. We'll be talking with, with him about medicinal mushrooms, and his work with medicinal mushrooms, and it's going to be a great show. And then next Thursday, we got Brandon Amalani, so a lot of cool stuff going on. So just to let you guys know, every Monday, Wednesday, and Friday, we broadcast live at 10:45 a.m. Pacific time. So if you guys want to join the show, ask your questions, join the chat, all that kind of good stuff, it's always a fun place to be. So make sure to join the live chat. And let me bring my face up here. And today is going to be cool because we're going to be talking with Dr. Darin Ingels, and we're going to be talking about his book, The Lyme Solution. And he's also the author of another book called The Natural Pharmacist, Lowering Cholesterol and Natural Treatments for High Cholesterol. So he's been at this for about 30 years. Like I said before, he's our doctor, and he's been doing this for a long time. And he's a naturopathic physician in the state of Connecticut. No longer, though, he told me, and he's going to be doing his practice primarily here in Southern California. So let me bring him up, and let's see here, turn his audio on. Okay, how you doing, Doc?
Oh, good, Justin. How are you doing?
Oh, doing so good. So before the show, you were all excited about now you're primarily based in Southern California, and you're loving that, right?
Right.
That's great. So what happened with Connecticut? Did you just not enjoy it there, or you wanted to stay here in Southern California?
Well, I grew up in Southern California, so Southern California has always been home, and I moved to Connecticut for a job, but I've always kind of wanted to come back, and then I met a lovely woman here, so she was kind of the impetus of coming back, and so now I'm finally back.
That's awesome. Man, and your book is just going crazy. The Lyme Solution, that was just released recently, wasn't it?
Yeah, it came out at the end of March.
End of March of this year, okay, in 2018. And I know we did a show before in our studio in person, but tell people a little bit about like your own journey, because a lot of times with naturopathic doctors, they don't speak from a place of actual experience themselves, but you yourself had Lyme disease, so that was a big impetus for writing the book, right?
Absolutely, yeah. I got infected with Lyme disease back in 2002, about 3 weeks before I was set to open my own practice. So the timing really couldn't have been much worse,
Wow.
And I had classic Lyme disease with, a headache and high fever and a big bullseye rash on the back of my leg. And I started treatment with antibiotics, which is, the standard recommended treatment. And after 4 or 5 days, I really felt quite well and didn't have any symptoms at all. But as I opened my own business, if anyone's ever been a business owner, they know what it's like when you are doing everything. So it was, 10, 12, 14-hour days for months on end. And after about 8 months of keeping up that schedule, I started to relapse and got symptoms again.
Wow.
So I went back on to...
Oh, sorry. At that time, were you were starting a naturopathic practice? Were you averse to taking antibiotics at that time?
No, at the time, I was fine. And again, when I had taken antibiotics initially, I did the standard 3 weeks of doxycycline, which is recommended by the CDC, and it worked for me as far as I could tell. In retrospect, now having learned a lot more about Lyme and seeing a lot of Lyme patients, my perspective has changed a bit. But at the time, I had a history of doing well and figured, okay, I'm getting symptoms again. I'll just go back to the same treatment. And I was expecting the same result, but
Mm-hmm.
I didn't get the same result. In fact, I went through a litany of various antibiotics over the course of about 9 months and actually got worse. So I was fortunate to have known of a doctor in New York City who was treating a lot of Lyme patients. And I went to see him, and he treated me with Chinese herbal medicine. And within really about 3 or 4 weeks, I started to improve, and I was really about 85% better. So I
Wow.
continued on his protocol for about 6 or 7 months and continued to get better. And then I kind of hit a plateau and I switched to a different herbal protocol, and that continued to get me better. And actually, eventually worked with a homeopath who gave me a remedy, and that really was the kicker that kind of got me 100% symptom free. So
Wow.
it took about 3 years from beginning to end to get to that point where I really felt like I was back to myself again. But
Wow.
eventually I did get to that point.
Wow, that's crazy. So when you took your initial round of antibiotics at the beginning, felt better, and then when you continued on, you said the symptoms came back and they were worse. What were some of the symptoms for you? And does it vary for all Lyme patients? Do they have different things going on, and then different degrees within each one of those symptoms, or how does it look for most people? And what were your symptoms getting worse?
Well, when I started to relapse, the first thing I noticed is I was getting what's called neuropathy. It was numbness and tingling in my hands and feet. I was starting to get back pain again, which is one of the symptoms I had initially. I was getting really tired. And of course, I attributed, well, I'm working long days. Of course, I'm tired. It's an easy
Yeah,
one to brush off.
right.
But when I started getting the neuropathy, that was sort of my red flag that something was changing again. So as I put two and two together with the constellation of symptoms, it made sense that this was, a relapse of Lyme. But everyone's Lyme is really quite different, and there's upwards of 100 different symptoms associated with Lyme. Many of them are very vague. So often when people get these symptoms, again, it's easy to think it's something else and not Lyme. So many doctors, when you go in and they do blood tests and other types of evaluation,
Uh-huh.
they might think it's something completely different. And often, when I see them, they've been to 8 doctors, 10 doctors. They've done a mountain of different blood tests and MRIs, and everything kind of keeps coming back negative. So when I hear about that combination of neurological symptoms and joint muscle problems, that for me is a big red flag that it could at least be Lyme.
Yeah, yeah. I saw on your Instagram, I think it was, or maybe it was on your Facebook. I don't remember, but it was a map of the United States, and how many people have Lyme. And is this something that is spreading and growing? Is it, are more and more people coming down? I just read an article the other day of the singer Avril Lavigne apparently
Yeah.
has Lyme disease, and I wanted to tweet out to her or send her a message about your work, but I just figured she's got so many millions of fans, she'll probably never see it. But, is this something that's growing? More and more people getting this?
Yeah, we have about 300,000 new cases of Lyme each year in the United States alone, and about 65,000 cases in the European Union. So it is the
Whoa.
fastest growing infectious disease in the world right now. And here in California, the
Wow.
CDC came out with a report not long ago showing that we are now the fifth fastest growing state for Lyme disease in the country. So this old thought that it's New England and the central Midwest, I mean,
Yeah.
these are definitely still the heavy endemic areas, but Lyme has been reported now in every single state in the United States, including Alaska and Hawaii.
Whoa.
So there's really no place that you're completely immune from Lyme. And I should qualify when we talk about Lyme, we're also talking about these other, what we call co-infections that you can get in addition to Lyme if you get bit by certain types of ticks.
Okay.
So we kind of use the term Lyme disease generically, but in reality, we know that upwards of 30+% of ticks in New England carry Lyme plus some other infection. So
Wow.
often people are co-infected with more than one thing, and
Right.
depending on where you live in the country, some of these co-infections might actually be more common than Lyme disease itself, depending on the area and the tick that causes the infection. So, when we start going through the process of evaluating people, I always remind people that it's important that when you're talking with your doctor, if you're going to do testing for Lyme, make sure you're testing for all these co-infections, because clinically they're very difficult to distinguish from one another.
Yeah, with so many different co-infections going on and so many different symptoms, I can imagine how people would just be like not easily able to figure that out. With the Lyme, is it only passed by tick, or is it passed by fleas? I mean, why does every state in the union have it? And what's the deal? Is it using other, like mosquitoes, other ways of transferring this stuff?
Well, conventional wisdom's always been that ticks are the primary carrier, and that's probably true. But we have some research out of Europe that suggests that mosquitoes and fleas carry Lyme. I think that would make a lot of sense. Seeing again, we see people with Lyme disease that live in areas that don't necessarily have the specific deer tick that we associate with spreading Lyme disease.
Right.
So I think it makes sense that there are other vectors that can transmit Lyme. And again, if you have an insect that bites you and carries blood, I mean, that's how we get it from a tick.
Yeah.
So it kind of makes logical sense that we can get it from other, biting insects. But, it's interesting because the research came out of Europe. I've heard some American doctors really kind of downplay and say, no, mosquitoes can't transmit Lyme. We have no proof of that. Well, just because the research wasn't done in the United States doesn't mean it's not true.
Right, right.
I think, again, if you look at the spread of ticks, though, the tick chart, not the chart in the United States of Lyme disease, but the ticks themselves, again, we've now seen these deer ticks extend all the way down the entire eastern seaboard through Florida, wrapping around through the Gulf. The entire western, states of the United States are now covered in ticks.
Wow.
And we see them slowly migrating inwards. We had some research come out not long ago showing that birds really are the primary reason that these ticks are moving out of their kind of home area. So, the migration of birds is, putting these ticks in different parts of the country. And that may very well be why, you get it in, Wyoming and not, Minnesota or someplace else. Again, we think of being more endemic.
That's wild. That is so wild. So how do you think you got it?
I am quite sure I got it from my dog at the time.
Really?
I had a small dog that, although I didn't spend a lot of time outdoors, hiking through the woods, I had a dog that would go out and be in the yard and do her business. And, she was a 5-pound dog, very low to the ground. So a real easy, carrier for ticks. The dog used to sleep in bed with me. So, I am quite confident that's probably how I got the tick.
Wow. So when you were initially, it's funny timing, right? Like you were saying before, it's interesting how you got it right when you're about ready to start your practice. And did you try anything on your own? Did you know that you had Lyme? And then did you try some things on your own that didn't work? And then you went to the antibiotics? Or did you go straight to that, that meaning the antibiotics, and then try other options after that?
Well, interestingly, I had meningitis when I was in college. And so when I first got sick, it felt a lot like meningitis because, again, I had this pounding, throbbing headache and high fever, and my neck hurt. And I was actually on my way to the hospital. And it just so happened as I was getting ready to go to the hospital, noticed I had the big bullseye on my leg. I'm like, okay, well, I can skip the hospital. I know what it is.
Yeah.
And at that point, in the acute phases, it just made sense to follow the standard treatment and take antibiotics. And again, within, 4 or 5 days, I was really completely fine. So, it didn't at the time really occur to me to do other things, nor did I really see a need at the time. I said I did the standard treatment and it worked initially. And again, in retrospect, I can see that, the treatment I had was probably not long enough, what we now know from the research, because Lyme is such a slow growing organism. 3 weeks of antibiotics just isn't enough. So I probably was undertreated at the time. And then, my terrain was compromised. I think had I not been in the situation I was in, that may have been enough and my body could have handled it. But, going right into a very high stress situation right after the infection, I think it was just the perfect storm. And that combination of stress and, not eating as well, not sleeping as well, plus having this, low-lying infection that probably hadn't completely cleared, that was just the right set of circumstances to allow this to start surfacing again. It just took 8 months for that to happen.
Right. That makes sense. Do you think that people with Lyme disease have, like, you know how they say with people with, or just the average people out there with cancer or anything like that, we all sort of develop cancer cells throughout our life, and most of the time our immune system, gets on top of it. I think I heard someone recently saying it was like, 6 to 7 times in our life do we develop, a noticeable tumor, but our body gets on top of it. Our immune system works properly. Is it possible with Lyme disease that there could be, if you have a strong functioning immune system and everything's working well, you're not stressed, you're living well and eating right, do you think it's possible to be infected with Lyme and not have any symptoms and never even know it? And then the people that do feel the symptoms, those are the people with weakened immune systems. Do you think that's possible?
Yeah, I think that's very possible. And I would argue that if I tested everybody in New England, I'd be willing to bet that maybe 60, 70% of people or more will show antibodies against Lyme. And they
Wow.
don't all have Lyme disease. So I think it very much is about the terrain, that
Uh-huh.
there are certain people, for whatever circumstances, that when they get infected, they get Lyme disease, and other people, their immune system gets rid of it right away. And they never get to the point where they become symptomatic. I mean, you could say that really about any infection.
Right,
You
right.
can get exposed to different viruses, different bacteria, and we don't all get sick. What's the difference? I
Hmm.
think the difference is the terrain. So when the terrain is healthy and happy and doing everything it's supposed to, we have an intelligent design to our immune system that it recognizes what's self, what's not self, and it keeps that in balance. And I think what we're seeing as a sort of a worldwide culture is that our immune systems are globally changing. We are losing tolerance to what is our own stuff, which is why we see more autoimmune disease.
Hmm.
And in that same vein, we're seeing, these things that may have been more benign infections in the past really become more problematic.
Hmm.
So it's really all the different factors out there in the environment that influence how our immune system functions. And it's everything from diet to chemical exposure to lifestyle. And I think certainly in the United States, we could argue that the American lifestyle is not necessarily the most conducive for good health, but
Yeah.
it kind of is what it is.
All right. I wonder if there's been any probably not. I'm just going to say I wonder if there's been any testing with regards to some of these new sort of environmental factors that are part of our lives now. Like just the other day, they started erecting this huge, big, giant cell tower right next to our neighborhood, and we're right next to a school. And so now Kate
Yeah.
and I are thinking, we might have to move because this thing is massive, and it's sitting right over. It's just sort of looming over our neighborhood, and I'm wondering if there's, if there's been any testing with regards to EMF or 5G or electricity, and I mean, there has been with our immune system, but I wonder if it's directly affecting something like Lyme. Have you seen anything about that?
Well, I think if you're talking about, specifically electromagnetic frequencies, we have, I think, enough evidence that, exposure, which is a function of distance, we know that high tension power lines, cell towers, these type of things that have a high output, if you're close enough, I think certainly has the potential to affect our health, including our immune system. Off the top of my head, I don't know that I've seen, any specific studies that have made that correlation. But clinically, we see plenty of people who live in areas that they're near these high tension lines or cell towers, and they seem to have more health issues than other people.
Mm-hmm.
I've seen just clinically, people in my practice that it can be as simple as a child that's got ADD or they don't sleep well, and we come to find out that their headboard for their bed's up against a wall in the house that has most of the wiring, and they move their bed to the other side of the room, and now they sleep perfectly fine because they're
Mm-hmm.
far enough away from that EMF output that it's not disrupting their sleep pattern.
Mm-hmm.
So I think this is an area where there needs to be a tremendous amount of research. I think we're just starting to scratch the surface on the effect. And 5G, to be honest, scares me a little bit. I think there's been some at least initial evidence that it's a bit more powerful than even the earlier 3G and 4G networks. But they don't certainly have any long-term safety data since the network really hasn't been unrolled yet. So we don't know. We won't find out until it gets out there. But I will speculate that we will start seeing other health-related issues secondary to that.
Yeah, I would think so too. I mean, like you said, I mean, 5G is brand new. It's not even rolled out yet, and they haven't done any testing on it. So what's going on with the spirochete, this Lyme spirochete that gets into the body through the tick? So does it doesn't originate inside the tick, does it? The tick must get it from somewhere else, right? And then I'm curious, like, what it does to the tick and then what it does to the human body once it's inside.
Well, the tick is really the carrier. We know that other animals, will carry this Borrelia, this bacteria that causes Lyme disease.
Mm-hmm.
So as the tick bites the deer, bites the mouse, and then gets on a human and bites us, ticks are basically parasites. They
Mm-hmm.
need a host to survive. So they're just looking to hop from one meal to the next. And as they share that blood meal, with an animal that's infected and then bites a human, part of that transfer of blood is that in the saliva of the tick is where this organism is harbored, and then it just gets passed through into our bloodstream, and then humans get infected. So it's kind of interesting that the animals that are carriers, as far as I know, don't get Lyme disease as we know of it. But we know that's true for a lot of other microbes, is that certain animals can be carriers. They don't get sick from the organism, and other animals get exposed and they become very ill from it.
Mm-hmm.
So it's sort of the nature of different microbes and how they have a predilection for certain animals and not others.
Mm-hmm.
But as humans, I mean, it's kind of interesting with Lyme, only in that, it's really not new. We pulled an Iceman out of Austria, 5,000 years old, and they did a blood sample and found that in his DNA there was evidence of Borrelia, of Lyme.
Really?
So, this bug has been around a long time. It's just, it really made news in the late 70s, early 80s when it hit, Lyme, Connecticut. That's why it's called Lyme disease.
Yeah.
There was a cluster of children in that area that had what they thought was juvenile rheumatoid arthritis, which is a pretty rare condition. And the fact that there were so many people that had it is what sort of raised that red flag that, hey, there's something else going on here.
Mm-hmm.
And it actually took several years for them to figure out what it was. There was a researcher who was actually a specialist in a different infection called Rocky Mountain spotted fever. And they thought it was one of those kind of organisms. So they sent it to his lab in Colorado, and it took him a few years to figure it out that it was actually a very different organism called a spirochete. And he's the one that identified it as a Borrelia species. So,
Hmm.
but again, I think it's really interesting, again, when you look at the pattern of different microbes over history. We had a time where tuberculosis and the plague wiped out a third of the world. They don't do that anymore. And it's not just because we have great antibiotics. We know that microbes can mutate, they can shift, they can, at some point in history become very immunogenic, cause a lot of health issues, and then they kind of fade away and become less problematic. So maybe this is a natural shift in that organism that just happened to hit around that time. Maybe there's other factors, but I do think it's just a bit odd that organism seemed to kind of come out of the blue and just start affecting so many people. And then from then, I mean, over the last, 35, 40 years, we've just seen it absolutely skyrocket.
Yeah, it's spreading like crazy. And so when it gets into someone's body, what is it doing? Do we know what it's doing inside the body and how it's acting and what's causing all these symptoms in people?
Well, strangely, I mean, a lot of the symptoms that people experience are really your immune system's response to fighting the infection. That's at least the initial part. So when people
Okay.
get the headache and the fever and the joint pain, that response is the immune system trying to eradicate it. What
Okay.
happens over time, though, is that your immune reaction starts to shift, and it actually becomes more like an autoimmune problem. So we know from the research that Lyme has the capacity to trigger part of your immune system that really becomes an autoimmune kind of a disease. And again, this isn't unique to Lyme. We see this with many other microbes. There's an immunological concept called molecular mimicry. And what that means is that there's a molecule on the bacteria or the virus that's very similar to something in our own body. So as
Hmm.
your immune system goes to try and fight that bug, it now accidentally starts fighting our own tissue. So a lot of these symptoms that we experience is actually the immune system response to it versus the bug itself going in and actually destroying the tissue. In the case of Lyme, that's actually rarely the problem. It's usually the immune reaction to the organism that's causing a lot of these different symptoms.
Uh-huh. So did you say at the beginning of the show there was around 300,000 people are diagnosed with Lyme, or is that how many people get diagnosed per year with Lyme?
That's 300,000 people in the United States.
that
And that's what's
actively?
reported. And we know that it's grossly underreported. So we don't know what the real number is. I think those of us in the field probably speculate it's actually probably 500,000 people or more
Half a
per
million
year.
people per year being diagnosed.
This is per year. So we are
Oh
now in a
wow,
place where we literally have millions and millions of people infected with Lyme.
wow, that is absolutely
I,
crazy.
I think the current population of the US is about 320 million right now.
Uh
So
huh.
you can do the math. If we've got 300,000 new cases per year, you know,
That's
it's a
quite a
lot.
bit. Yeah, my goodness. So you probably see a lot of your patients. A lot of your patients come to you, and I'm sure you treat a lot of people with Lyme, right?
Oh, absolutely. Yeah, that's a
Yeah.
big part of my practice.
Yeah. Wow. And so, in terms of like some of the worst cases, what are some of the like really bad cases you've seen?
Well, I mean, the worst case is death. I mean, Lyme disease can be fatal. Fortunately, this is a very rare complication of Lyme, but I
Mm-hmm.
have a colleague that got Lyme several years ago. She passed away last year. I've fortunately in my own patient population, I have not had anyone who's died from Lyme. But again, if you go out there and read, there are a handful of cases each year of people that do die from various complications related to Lyme. So that's the one end of the spectrum. The other end are people who have nuisance symptoms where they're just tired all the time, or they get these low-level headaches, and then you've got everything in between. I've
Mm-hmm.
seen people in wheelchairs. I've seen people that need a cane to walk. I've seen people who are diagnosed with MS. There's just a wide variance on how Lyme affects each person.
Mm-hmm. Yeah, and I would imagine, yeah, I mean, each person is going to be feeling different, and and also too, if someone who has Lyme, I would imagine they might first think it's like chronic fatigue syndrome, or they might, if they don't see the bullseye sort of tick bite, they might not even know what to look for or what the doctor. And most doctors probably don't know what the heck to do testing on this for either, do they?
Yeah, and that's the problem. Again, the symptoms tend to be very vague. If you come in and you're just tired and your joints hurt, your doctor might, check your blood count, make sure you're not anemic. They might do a screen for autoimmune disease. And unfortunately, with Lyme, a lot of the standard autoimmune blood tests that we look for lupus and rheumatoid arthritis, they all come back negative. So your doctor says, yeah, everything's negative, you're fine, and yet you just feel terrible. So again, depending on where you are in the country, I mean, I think doctors in New England are probably a little bit more savvy to at least looking at Lyme.
Mm-hmm.
I find here that in California, the doctors here are pretty ignorant, and most of them are not even thinking about Lyme. So depending on where you are, you may have a doctor who's a little bit more knowledgeable than others. But we run into a secondary problem that the testing itself isn't great. And, we know from the research that the test that's recommended by the CDC is not a very sensitive test, which means if you have the disease, what's the likelihood it'll pick it up? And the sensitivity for the Lyme test is only about 43 to 46%. So it literally doesn't even pick up half the people that have Lyme. And that bullseye rash, again, if you read the CDC's website, they'll tell you that 70 to 80% of people with Lyme get that rash. Again, I think the research contradicts that, and we figure it's actually probably 40% or less.
Oh wow,
In my practice, I rarely see someone who gets the bullseye rash. In my practice, it's probably less than 25%. So,
wow.
we can't rely on the rash as a marker that you do or do not have Lyme. Now, if you do see that classic bullseye rash that looks like, if you've never seen it, it looks like a bullseye or a target. That is a telltale sign of Lyme. And as far as we know, there's really no other organism that causes that kind of rash. So when you see that, that's sort of your hands down, you've been exposed to Lyme. Now, there are other, I said, co-infections that can cause other types of skin rashes that are not those target-shaped rashes. So other skin lesions, if they've been there persistently, we need to evaluate and see if that's, part of what's going on with people. Yeah, you've got some great pictures there of that rash. It's interesting. I get calls all the time when people get mosquito bites. That's a great picture you've got up now because it shows that target where you see dark, clear, dark, clear. If you get bit by a mosquito or another biting insect, you can get a histamine reaction, which you'll see kind of a raised bump in the middle, and then it gets red around it. People think often that that's this erythema migrans rash, and it's actually just a histamine reaction that's a reaction to the venom of whatever bit you. So it looks quite a bit different. The one thing about this rash that may be hard to tell from that picture, if you're looking at it, a Lyme rash is a very flat rash. So if you run your hands over the skin, you don't feel anything raised or bumpy, whereas like a mosquito bite, a flea bite, you'll feel a little bump where the insect bit you. So that's part of the way that we try and help distinguish that type of rash.
Yeah, fascinating stuff. Doc, stay right there. I'm going to bring up your website so people can take a look at it. If you guys are interested in Dr. Ingels' book, I'd recommend it. The Lyme Solution. It's a 5-part plan. And when we come back from the break, I want to get into what some of those aspects of the plan is, or what they are. You got a whole thing about the gut protocol, immune system, hidden toxins, sleep, exercise, stress reduction, all of these things to help boost your immune system. So check out his website, Darin Ingels, ND, Darin Ingels, DARININGELS, DarinIngelsND.com, and you can check out the Lyme Solution book. And if you have anyone with Lyme, please pass this show on, and his website as well, and his book as well, The Lyme Solution. So we were talking a little bit earlier about this dirty electricity in the walls and its effect on our immune system. And I wanted to tell you guys about this new sort of technology that we've come across on our show called the green wave filters. And what they do essentially is they don't block like wireless radiation or 5G or some of these ambient electromagnetic field radiations that are sort of non-native to Earth. They work primarily on the dirty electricity that's in our home. And we had Magda Habas on the show, had a lot of people talking on our show about electricity and what it does to our health. And there's been studies showing that it affects blood sugar levels, it affects insulin resistance, it affects all kinds of different mechanisms in the body, like cellular mechanisms that disrupt us basically from producing antioxidants and hormones. And so this stuff is really, really crazy. And for some reason, we went with the 60 hertz, which is the most detrimental and dangerous electrical field. Why we didn't go with any other option that Europe went to, it's kind of weird. But whenever you have an electrical current in the wall, you also have a corresponding magnetic field from each of those wires. And that's why Dr. Ingels was saying before the show, or during the show, to, a lot of people sleep close to these, electrical wires in their wall and are having all kinds of health problems. So the green wave filters, what they essentially do is you plug them into your wall and they cut down all of that dirty electricity in your wall almost to 100%. And what's cool too is that, I don't know if you can see in this photo, but they actually have a plug on the bottom of it. So you're not losing an outlet, which I thought was really cool. There's other filters out there where you actually lose one of the outlets, and they have 2-prong and 3-prong different solutions for your home. So if you guys want to put these maybe in your kid's room or in your bedroom, which I would highly recommend. That way you decrease all of that electricity that's sort of stray voltage, but it's in your walls and the walls of your home and affecting negatively your health. And so make sure to check out the green wave filters. I'd highly recommend them. I'll put a link to it in this particular chat that you guys are watching on YouTube. And I also wanted to tell you about the Symbiotica DHA algae extract. We've been on this stuff, and we actually really, really love this stuff. If you listen to people like Dr. Jack Cruz or other people like that talking about why DHA is so important for our health, you start realizing it helps to create an electrical voltage, an electrical charge in the body. And as Dr. Jerry Tennant says in his book, healing is voltage, and allowing our bodies to create that electrical charge inside our mitochondrial membrane or on the surface of it is so important. And when you start understanding mitochondria, you start understanding that the mitochondria are basically the powerhouse of the cell, right? There's roughly 3,600 to 10,000 different mitochondria, depending on what cell you have. So 3,600 different mitochondria inside each and every cell of the body. The heart has more, the brain has more for obvious reasons. But it's the mitochondria that controls genetic expression. And basically, DHA is mitochondrial food. It helps you hold on to more light. It helps you to create, it helps the mitochondria to create more water. And now it's infused with astaxanthin as well. And the studies on astaxanthin are just incredible in terms of what it can do. It's 6,000 times more powerful than vitamin C, 8,000 times stronger than CoQ10. This is astaxanthin. Over 500 times stronger than vitamin E. It helps to decrease blood pressure and lower cholesterol levels. I mean, astaxanthin, we've done a whole show on astaxanthin. So combining it with the DHA is super, super beneficial. And Matt and Shervin, who run Symbiotica, were nice enough to give us 15% off, or give you 15% off. So if you want to enter the code EHR for 15% of Symbiotica, I'd highly recommend getting on this, because you're going to feel better. It's going to help your mitochondria work better. And when your mitochondria work better, everything works better in your whole body. So I highly recommend Symbiotica DHA. So let me bring Dr. Darin back on the show. And let's see, Doc, I wanted to ask you about your sort of 5-step protocol, because, this is super important with people. Why did you start with the gut as the first part of your 5-step protocol?
Well, the gut's really the foundation of our health. And, if you consider that up to 80% of your immune function comes from the gut, if the gut isn't functioning well, your immune system's not going to function well. Mm-hmm. And the gut's also, of course, involved in, digestion, absorption of your nutrients, which are the powerhouse behind, cellular repair, energy, mitochondrial function. So we got a lot of stuff that's happening in the gut, and it's just, critical that everything there is working the way it's supposed to, so that we really optimize our cellular function and our immune system. And I see so many people with, certainly chronic Lyme, that have a history even before they got Lyme disease of some sort of gastrointestinal problem, whether it's, persistent constipation or diarrhea, gas, bloating. There's usually some evidence that the gut hasn't been working as well as it should. So, we really focus on, trying to do things nutritionally to help repair the gut, rebuild the gut ecology. And again, I think living in Western society, we just get exposed to so many different things that disrupt our normal microbiome. And with all the research coming out on the microbiome and how important it is for just about everything, it seems like, cancer, heart disease, diabetes, all of these have some relationship with our gut microbes. Mm-hmm. So between antibiotic use, chemicals in the environment, we have a lot of things that have been changing that ecology. And I think nowadays too, we're seeing more kids born by C-section. And we've got research showing that C-section kids get colonized with mom's skin flora and not with her colonic flora. So it's different, and it affects them differently. So, that first part of my book, that first part of the plan is really about what can we do naturally to help, rebuild the gut ecology, rebuild the lining of the intestinal flora, or the intestines and the stomach, so that, we're really, again, making sure that everything is working the way it's supposed to.
Mm-hmm. Yeah. So what are some of the things typically that you'll give people to in terms of nutritional approaches? And I mean, obviously, one thing that people don't think about when it comes to gut health is stress too. It's like, it's easy to sort of take substances, right? But then, lowering stress, I mean, that's a hard thing to do, right?
Well, yeah, you consider that you've got more nerve endings in your intestinal tract than you do your brain.
Wow.
This gut-brain connection is extremely well laid out and has an intelligent design. Which is why when we, get under stress, we often experience gastrointestinal problems. So, yeah, I think living certainly in the United States in 2018, we've got plenty of things that stress out a lot of people all the time. And managing that, it's easy to say, well, just don't have stress. Well, that's not going to happen. So, we've got to teach people to, help alleviate a lot of that stress, keep their mind in a healthy state. So, we talk so much about the physical aspects of chronic illness, but there's a huge mental, emotional aspect that we may not really have time to get into today. But I think that's something that, needs to be looked at if it's, a chronic problem that you've been dealing with.
Mm-hmm. Yeah, I totally agree with that. A lot of what we talk about on our show is the mental, spiritual, emotional aspects of disease processes, and how these things, sometimes maybe carry on for more than one generation. And that's a whole separate separate subject, but I like that you mentioned that. So when it comes to gut health, what are some things people can do just off the top of your head to help improve gut health and, obviously lower stress? And then what are some things people might want to consider, not including into their lifestyle? Like you said, antibiotics, that's obvious, but what are some other things people might consider removing and then adding in?
Well, I think, some of the basic nutritional things that people can take just to help, rebuild the gut again, particularly if there's been any history of antibiotic use. Certainly probiotics can be added in safely to help, restore the normal gut flora. We know again from the research, there's trillions and trillions of different bacteria in your gut. You take a probiotic, you might be taking 1 strain, 3 strain, 12 strains. It's really a drop in the bucket. So it's not about colonizing the gut with those specific strains. It's about that transient effect that those bugs have on restoring the balance in your gut. So there's a lot of really great probiotics out there. We have one that we had custom made for our practice, but there's a lot of great companies out there. I think when people are choosing probiotics, just be aware that you get what you pay for. And you really want to work with companies that have done their due diligence to ensure that what you're paying for is what you're actually getting. When I was a medical student, we did a study on 20 different probiotics, professional, over the counter, refrigerated, non-refrigerated. And out of all 20, only one of them actually had what was on the label and in the quantity that was stated. That happened to be curable, by the way.
Wow.
Where the other 19 either had something else in it that wasn't on the label or not in the quantity that was stated. So there is an inherent manufacturing issue with making probiotics that make it very difficult. I use, I think Claire Labs makes really great probiotics. Master Supplements makes great probiotics. Culturelle is a great probiotic. So my feeling is it's a good idea to get variety. So I usually tell people get 2 or 3 different probiotics and every week rotate, give your gut a different look. And clinically, that actually seems to work pretty well for a lot of people.
Yeah.
So probiotics, again, is something that anybody can add in at any age. I also like glutamine. Glutamine is an amino acid that's very nutritive to particularly the small intestine. It is the fuel source for these intestinal cells to repair themselves.
Oh.
So particularly for anyone who might have been disposed to SIBO, small intestine bacterial overgrowth, other types of digestive issues, glutamine, again, is an amino acid that could be safely taken by just about anyone. The only people who can't take glutamine are people that have inflammatory bowel disease. So if you have Crohn's disease or ulcerative colitis, there's some evidence that glutamine will make things worse. But outside of that, it's a very safe amino acid and, again, can help repair the integrity of the gut. So those are sort of like 2 of my starts. And I talk about in the book other types of things to help with tissue repair.
Are you a fan of colostrum and maybe bone broth, things like that for gut health as well?
Colostrum, I think colostrum as an immune stimulating agent is fine. In most cases, I find it quite expensive relative to other things out there that I think would work as well or better. So I've never really been on the colostrum bandwagon. Bone broth, again, I think is fine. I've always had concerns about bone broth, that bone tends to concentrate heavy metals, particularly lead. And up until recently, no one's really done any research looking at lead content in bone. And for people who are regular bone broth drinkers, is that going to add to their toxic metal load? I actually have a colleague that did a very small study just using 4 different types of bone broth. And at least in that little pilot study, they actually did not show any appreciable amount of lead leaching out, even for people who are drinking bone broth every day. So I feel a little bit better about it now that I don't know there's as much of a concern about accidentally contaminating people with lead. But, again, I think, we kind of get into sort of the next part of my book where we talk more about diet. And my feeling is if you're eating a good, clean diet, I think there's a lot of things there nutritionally that will help facilitate repair, even if you're not drinking bone broth.
Yeah. No, it's good. So yeah, it's interesting you start with the gut because if you heal the gut, then you can actually start absorbing the minerals and vitamins and things that you're going to start doing with your diet. Because
exactly,
if you start with the diet, then, a lot of people's guts may not even be able to absorb that stuff, right?
Exactly. And, in reality, we're kind of doing both simultaneously. But, when I know, especially that there's been that history of previous antibiotic use, there's a good chance, the gut's been disrupted. I mean, again, I can use my own self as an example. I mean, I was an ear infection kid. I had ear infections every month for the first 5 years of my life. So I was literally on antibiotics every month for 5 years, pretty much continuously.
Wow.
And so I think, again, I can kind of look back at my own health and say, I kind of came out of the gate, behind the 8 ball, because my
Yeah.
gut was disrupted. I was still in those early stages when my gut was developing, and I was already on antibiotics that was shifting that ecology.
Wow.
So again, as much as we can protect particularly young children from getting exposed to antibiotics, that certainly helps with the potential long-term effects. But for anyone who's already had that exposure, it is what it is, and we just have to deal with it. But again,
Hmm.
I don't think there's anything there that can't be undone.
So you don't think antibiotics can permanently damage the system to the extent that it can't, something couldn't be undone? You think it's all fixable, right?
Well, yeah, I think the nature, again. I think we have a smartness about our body that it knows how to repair itself, and even with our gut microbes, I think we can recolonize it back to a normal, steady state.
Hmm.
One of the interesting things that's coming out recently in research is what they call fecal transplants. They're still relatively new in the United States, anyway, and they're only really done mostly at research centers. But the concept of transplanting your entire microbiome makes a lot of sense. And again, with all the research we've been coming out with, how it affects all these different health conditions, anywhere from MS to diabetes, I think we will find in the next 5 to 10 years that this becomes standard therapy.
Hmm.
I think the challenge that the research centers are running into now is, who's an ideal donor.
Mm.
Who's out there that's never had antibiotics or had antibiotic exposure.
Mm.
Who really has a healthy gut? I think those
Yeah.
those people are probably few and far between. But if they can find the right donor, I think this has a great potential. And they've been studying it right now for C. diff infections,
Uh-huh.
but the success has been tremendous. And I think we will find that there's application to other types of conditions, including autoimmune diseases and probably even Lyme disease.
Yeah, I was talking to a Dr. Stephen Hines out in, gosh, where is he? Somewhere in Texas, and he was saying that he's seen some research showing really incredible results with children with autism, with kids with autism,
Yeah.
with these fecal transplants, and it doesn't seem to stick. He was telling me that within 3 to 4 weeks, their symptoms slowly start coming back, so then they need to get another sort of infusion of the fecal matter, but I mean, that's showing you right there, right, that there's some sort of connection between autistic symptoms and even Lyme disease and everything else and our gut flora.
Yeah, well, I think again, it just speaks that connection between our gut and so many other health conditions. Again, I work with a lot of children with autism in my practice. I have had parents that have done their own home, fecal transplant and reported back that their kids improved. It makes sense that it wouldn't be a one and done kind of thing. Your gut's very complex, and you're trying to basically shift your entire flora. I could imagine that would take several times of doing it. But
Mm-hmm.
the fact that we do see this clinical improvement, even if it's temporary, kind of tells us we're on the right track. And again, it just sort of solidifies that there is this relationship between our gut microbiome and how our brains function.
Mm-hmm.
But whether it's a neurological application or an immunological application, I think we'll find again that this is going to be huge when we can get to a point where we find those ideal donors and find out the best way to deliver it, because they've done it through colonoscopy, they've done it through an NG tube. I know that Yale was doing a study where it was freeze dried poop in a capsule.
Wow.
So they're
Wow.
they're finding different ways to deliver it, and what's the best way. And again, I don't know that we've clearly figured that out yet, but that's coming down the pike.
Yeah. Yeah. There's another doctor we had on the show, and he was saying that some of his research is showing that there should be roughly over 1,000 different species of organisms, and obviously that's going to translate to trillions of actual organisms. But he was saying there
Right.
should be over 1,000 different species, and I think he was saying in the Western world we're down to I think less than 300 now, and so
Wow.
that's crazy, right? I mean, you think about autoimmune diseases and Lyme and the immune system, and just all translates, doesn't it?
Well, it's really interesting. I think if you look at Africa as a great example, where infection is still fairly rampant, but
Hmm.
what they don't have is they don't have allergies and they don't have autoimmune disease.
Hmm.
And I think there's been a good argument that in Western society we've become so sterile. Our food gets irradiated, everything gets washed and whatever to try and keep bugs away, that we've lost that part of what was creating our microbiome. We've lost that diversity.
Hmm.
And, there's a reason that kids play in dirt. There's a reason that kids mouth. I mean, it's not just because they're teething. I think there, again, is a wisdom that's a way that we inoculate ourselves to these different things out there in the world that ultimately become part of our normal microbiome. And
Hmm.
we always think of, our normal microbiome being bacteria, but remember, it's viruses and parasites too, and yeast. That's
Right.
all part of the mix. And I think the biggest thing they found, again, when we compare ourselves with African people, is the loss of parasites. In fact, Duke has been doing research on what's called HDCs. It's basically a rat tapeworm, which we used to ingest naturally through certain grains. And again, in the process of cleaning up food, we don't really get that exposure anymore. But they've been doing research on MS and autism and other types of neurological conditions. I personally take these myself as a probiotic. I find it helps a lot.
Wow.
But again, we may find that reintroducing certain types of parasites back into our microbiome is actually going to be very helpful for our immune system.
Hmm. Man. So if you guys are watching this, you can go visit drdarinengelsnd.com. Make sure to check that out. And if you guys are following Dr. John Bergman and watching on Dr. John Bergman's channel, and you're local to the area, Dr. Ingels is in Irvine, California. So make sure to check him out and go get an appointment with him. Doc, so part of your protocol too is like environmental toxins and chemicals and things like that we're exposed to. And you mentioned on your website mold, and how mold sort of copies a lot of other different, health challenges people have. So talk a little bit about mold exposure, and how it impacts Lyme disease, and how they're both tied together.
Yeah, well, mold is the one thing I think mimics Lyme more than anything else in terms of symptoms. And when I've had someone who we think has Lyme based on their previous testing and history, and we go through Lyme treatment and we're not really seeing the kind of improvement we expect,
Mm-hmm.
it may very well be that Lyme is the smaller part of the pie. It may be related to something like mold.
Wow.
I used to think mold was always a problem more out, when I lived on the East Coast, because buildings are old and it's humid, you get a lot of moisture. It kind of makes sense why you would see more mold problems in that part of the country. And when I moved out to California, I was surprised the number of people I've seen here that have mold issues. And I think the big difference, when you leave out on the East Coast, or certainly a place with basement, when you get water damage in your home, it generally makes its way to the basement at some point, and you'll start to see little pools of water, and that's your alert that, oh, there's a leak somewhere. And in
Uh-huh.
California, where there are no basements, that water may leak out the back of the building or stay on the wall. And I find here people just don't know that they have that exposure. But clinically, mold can make you tired, cause brain fog, can make you achy, can cause respiratory problems. There's, again, just kind of a litany of symptoms associated with mold exposure. And with mold, there's really two aspects of it that make it problematic. You can get exposed to things called mycotoxins. There are certain chemicals that are excreted by very specific types of mold that, when you breathe them in, it can damage your nervous system, damage your lungs, can be actually very serious in certain cases. But you can also have an immune reaction to mold spores or mold allergy.
Mm-hmm.
Clinically, between mycotoxicity and mold allergy, they can look kind of the same. They're treated completely differently. So when we're going through the process of trying to figure out if mold is part of the problem, you have to do different types of testing to figure out, what aspect of mold may be causing a problem. But again, the good news is that there are ways of testing for both. There are ways of treating both, and clinically, they both actually really help people who have these kind of problems.
Mm-hmm. Yeah, and it's an issue too, because there's mold spores everywhere. You realize that how this mycelia of the mold, it's basically underneath the surface ground of the whole earth. It just spreads like a spider web, and it's obviously people going to have black mold in their house, or mold in their walls if it's not sort of cleaned up or maintained properly. And this different tests that you could do. And I would imagine that, if someone's living in a moldy place, the first thing to do would be sort of move, right?
Well, yeah, and depending on the nature of which mold you're exposed to and the extent of the damage. I mean, I'll give you a great example. We had a grade school where I was living in Connecticut that had a leaky roof, and the town didn't want to spend the $100,000 to fix the roof. So it leaked for a long time, and it eventually got to a point where it had a toxic mold called Stachybotrys. It was so bad they couldn't even fix it. They had to raise the whole building. So we now have a $42 million new school.
Wow.
That was the only way to fix the problem. So mold damage can get extensive to the point where, you know, your only option is to move. And the
Hmm.
problem is once you get that mycotoxin exposure, it can get into anything in your home. It gets into your furniture, your books, your clothing. So often when people have had extensive mold damage, you know, you get to a point where you kind of have to get rid of most of what you own just to protect yourself as you move out of it. But, you know, again, it's a gradation. In some cases, the mold is relatively minor. It can be remediated appropriately and safely. But, you know, my feeling again is if people have had these long-standing health issues, they're not feeling better, it's a good idea to have a professional company come in, have your home tested, just make sure that's not part of the problem. Because people say, well, I don't see anything, I don't smell anything. Well, that doesn't mean anything. I mean, a lot of mold you can't see or smell. If it's buried in a wall somewhere, you won't you won't experience it, you won't see it or smell it, but
Hmm.
that doesn't mean that you're not breathing in these spores or these mycotoxins and that they're affecting your health. So, you know, for the however much it costs to have your home tested to ensure that it's safe, I think it's worth it.
Yeah, you know, it's interesting you said that. I never really considered the idea of realizing that these mold spores could be in your clothing and your books. And I mean, I guess it makes sense, right? If they're floating around and basically just passing through the air, and if they're so small that they can get, you know, sort of embedded into our clothing. I wonder if just standard wash, you know, washing clothes, do you think that gets rid of mold spores?
It can. I find with clothing, often people have to wash their clothes several times, and maybe three, four, 5 times to really get everything out. Remember, we're talking about both mold spores and mycotoxicity.
Hmm.
Mycotoxins are a little bit harder to get rid of,
Hmm.
but again, anything that's porous. So that's why I said anything that's, you know, paper, cloth. So people that have, you know, chairs or couches that are made of cloth. You know, again, those spores can get in the cushions, can get in there, and it's hard to clean at that point. I have a colleague who's had mold exposure, I think, at least twice in her homes. She has had to throw out everything she owns twice now and start over again. So um, it really just depends. It also depends on your sensitivity level. Again, I've also seen people that they have mold, they get it remediated, they clean what they can, and they feel fine afterwards. So, um, but you know, again, if you find that you do have mold, you need to make sure you get a company that actually specializes in mold remediation. Your general contractor out there generally knows nothing about mold. They have no idea how to fix it appropriately. You know, they go in, they kind of replace the drywall, the insulation, they patch it back up, and they're out.
Yeah.
And that will not be adequate enough. That can
Yeah.
still leave you with a lot of problems if it's not remediated appropriately.
Yeah, I hear you. In terms of like part of your protocol is targeting active compounds, you know, in the body and infections. And what are some more advanced tools? I mean, people are using everything from Rife machines to there's the AMP coil that has been recently talked about, which is a combination PEMF, combination Rife machine, frequency
Yeah.
generators. There's all kinds of stuff out there. What are you looking at in terms of actually targeting these infections?
Well, what I outline in the book more specifically is about herbal protocols.
Okay.
I do talk elsewhere in the book about some of these other things like, you know, PEMF, but that first part is really about herbs, and in lieu of using antibiotics to help, you know, kill the infection, I know herbs have a much broader effect. Not only do they go after the organism, but they're anti-inflammatory. They help improve your circulation. They help boost your immune system. So you kind of get multiple bangs for the buck, so to speak, with
Yeah.
using herbal medicine. And again, clinically, I find they work very well. I think some people are under the impression that if they use herbs and not antibiotics, that they're somehow sacrificing better care. Uh, People don't understand that they're different, and a lot of these herbs are very potent. And I've had patients that they'll sometimes take 1 or 2 drops of an herbal tincture and they get a die-off reaction. So
Wow.
you know, everyone's a little bit different, but you know, my patient population are primarily people who've already been through antibiotic therapy and have failed. So they're looking for different options. But I've had people with acute Lyme disease. We put them on herbs. They respond very well. We don't disrupt their entire gut in the process.
Hmm.
So I think, you know, for people, for practitioners who are very skilled in herbal medicine, they kind of know that this is a good way to treat these infections that you minimize the adverse reactions, yet you get good clinical effectiveness in terms of treating Lyme or any of these co-infections. And by and large, I have rarely at this stage now have had to use antibiotics for Lyme.
Wow, that's interesting. I mean, herbs, people think herbs is not very powerful, but I mean, you look at like, something like oregano or something like that. I mean, that'll just burn your throat. That's powerful stuff, right?
Yeah, I mean, well, with herbs, again, it depends how the herb is prepared. I'm like, yes, if I make a tea of a particular plant, it may not be very strong.
Right.
But if you take a tincture that concentrates the herb, that's stronger. And there's other ways of freeze drying certain herbs that make it even stronger. So there are a way to potentize these herbs to give a stronger clinical effect. So, when we talk about herbs as a whole, about being, at least compared with antibiotics being effective, I think you have to look at the form of the herb that you're using, the type of herb. We know that some herbs are better as tinctures, others better as teas, other are better as capsules. So again, anyone who's trained in herbal medicine knows these differences and knows how to apply them appropriately. So a lot of the herbs that I use, whether they're tinctures or capsules, are highly concentrated. They're very potent. And again, we'll find sometimes even with small doses that people get a good, clinical effect.
Mm-hmm. Yeah, I'm just showing your website here with your Lyme solution book. I guess that makes sense what we were talking about earlier with the 300,000 new cases a year. I mean, I'm just looking here, 823 new cases of Lyme are reported. And those are the ones that are just reported, like you said, every day.
Yeah.
It's crazy.
And well, I said, we know that it's grossly underreported, and I don't know that we'll ever really know what that real number is. All we can say confidently is that it's a lot, and it's
Uh-huh.
growing.
It's growing all the time.
Unfortunately.
Yeah, and it will continue to grow too as well, right? Just with population increase. I mean, that alone will obviously be impactful there.
Well, I'll give you another really interesting example. I have a young boy here in Southern California whose mom has like classic Lyme disease. She was CDC positive. Her son started developing fever out of the blue, joint pain, headaches. He was admitted to the local children's hospital. He was in the hospital for 2 weeks, and the head of infectious diseases refused to even test him for Lyme disease. Wouldn't even test him. And the mom's begging this doctor, even as she's like, look, I've had Lyme disease, I've had these symptoms. And after he was discharged, we tested him. He tested positive. We treated him with herbs, and he's doing great. He's completely symptom free. But I was just, I think the English term is gobsmacked.
Yeah.
The head of infectious diseases at the local children's hospital wouldn't even bother testing him. I don't understand that at all.
Yeah, it makes zero sense, especially with the prevalence of this disease. So many more people getting it every day, and it's just growing like crazy. That's unreal. I mean, maybe there's some, I don't know. Maybe, I mean, it can't just be oversight, could it? Do you think a guy like that, he's got to know about Lyme?
Well, I think, well, certainly in California, I think a lot of doctors here truly believe that we just don't have Lyme here. We're just not, that's a New England problem, or a central Midwest problem. We just don't have it on the West Coast. And all I can tell you is that that's ignorance. They need to read. There's plenty of evidence showing otherwise. And this is coming straight from the CDC, who we could probably all agree is a very medically conservative government organization.
Uh-huh.
But all the data that's coming out on the spread of ticks and the incidence of Lyme disease, that's all coming straight from the CDC. So this is not anything that's fringe. This is, well documented. And again, with California now being the fifth fastest growing state, you would think the doctors here would really be more attuned to it, but I'm not finding that by and large.
Yeah. Oh man, it just takes a long time to change, philosophy, change policy, for doctors. It takes a long time. I mean, they're buried in seeing people all day. I mean, they're so busy that, I mean, I guess it makes sense from just a busyness perspective, and maybe even from a financial perspective too, but that's a whole different show. So if people want to get sort of involved in what you're doing with Lyme, would the first place to be to join your newsletter or to get your book? Like where should people go and get started?
Yeah, the best place is go to our website, dariningelsnd.com, and we'd love for you to sign up for our newsletter. And we have a lot of information about not just Lyme disease, but other aspects of health. We'd love for you to join us on social media, on Facebook and Instagram. And we're constantly posting information that I want to be valuable and helpful. And then we have an online store if people are looking for, healthy products that are hypoallergenic and clean. We offer, we periodically send out coupons for the store, and we want to be a resource for you and helping you get healthy and well.
Yeah, that's great. I'm just showing some of your products here. This is really great. So yeah, so if people have Lyme disease, is there a section of the store where people could get Lyme specific supplements or
Yep,
not?
right there where you're popping under supplements, there's a whole section that says Lyme support.
There we are. Alphabetical off to the right. Okay. Yeah. Okay, great. So these are some of the things that you would recommend. And obviously if someone comes in to see you at your private practice, or if they do it virtually, then you might put them on some of this kind of stuff, biofilm buster.
Yeah, this is a lot of the products that I use, and all these products are outlined in my book. So, my book was written for people. It's really as a self-help guide. There's really only one chapter in that whole book that you really need a healthcare provider to guide you on those therapies, but everything else is something you can do on your own. So, one of the things I have in the book is a questionnaire. So, if you think you might have Lyme, you're not sure, buy my book, go through the questionnaire and see how you score. And I think that'll give you a pretty good idea about whether you're higher at risk. And if you are, you can certainly talk to your local practitioner about getting Lyme testing.
Mm-hmm.
Otherwise, I have some people who score high and they just start on the protocol anyway. Look at Lyme as a clinical diagnosis more than a lab diagnosis. So if you've got the signs and symptoms and you score high on that questionnaire, there's a probably good probability that that's part of what's going on. And you can start, one of the herbal protocols I outline and, rebuild your gut. And again, the whole book is really designed to be for you and something that anyone can follow.
Mm-hmm. Mm-hmm. Do you see people virtually or only physically in your clinic?
I always like to see people in person, but the nature of how things work is we do work remotely with people if need be.
Okay, so what they could do is call your office if they want to work with you, and then the ladies at the front desk can set them up with a way to do that?
Absolutely.
Okay, cool. Well, Doc, thanks for being on, man. I'm sorry we couldn't do this in person. We're only, not too far away from each other. We've been having some microphone issues, so we had to do it virtually today. So
that's okay. It was I always enjoy talking with you, and this was a lot of fun, and I appreciate you having me on your show.
Yeah, no problem. By the way, Kate has made an appointment to see you, I think, sometime in October. So you'll be seeing her in October.
Great. Well, I'm thrilled for you guys, and I'm glad to hear the twins are doing well, and I'll look forward to catching up with her.
Awesome, Doc. All right, thanks so much for being on the show, and I will talk to you very soon, and I'll be in touch via email with the links and everything like that.
Great. All right, thanks, Justin.
Awesome. Thanks, Doc. Bye.
Okay. All right, bye-bye.
Alrighty, there you go, Dr. Darin Ingels, and I was just bringing up part of his show, and he works with people. Let me take these out of my ears, actually. I don't like having these things in as little as possible. But he works with people with allergies, autism, allergies, asthma, eczema, food allergies, sensitivities, chronic fatigue syndrome, fibromyalgia, autoimmune diseases, mold toxicity, endometriosis, migraines, hormones, irritable bowel, inflammatory bowel disease, celiac, recurrent illnesses, environmental illnesses. So if you have any of those issues and you like Dr. Ingels, call over there and make an appointment to go see him. So I've got some things to share with you too. I wanted to do this during the show, but I wanted to share with you some upcoming summits. Now, these are really cool summits, and I want to make sure that you guys know about these things. Okay, so the first one, let me put these in the chat room. The first one is the Autoimmune Revolution Summit. Let me do this and pop it right here in the chat room. And if you guys are watching later, I'll put a link in the bio as well, or in the I keep saying bio, but it's actually a link in the description of this YouTube channel. And then this one here, so the Autoimmune Revolution Summit starts October 1st, 2018. That's less than a week away. That's this coming Monday. And then this is the cool one too, is the Truth About Cancer Summit. That is coming up on October 9th, I think it is. And I don't know about you guys, but I'm just seeing so many people. Like, cancer is just, man, talk about something, a pandemic and a plague of our time. Okay, so as many of you guys know, I got involved in this whole natural health field as a result of my mom's being diagnosed with non-Hodgkin's lymphoma. back in 1995, right? So that's how I got involved in all this. Then it seems like more and more people are being diagnosed, right? And I don't know if you see that, but I see it. I'm only 42 years old, but I see stuff like when I was 36, a friend of mine from high school died from colon cancer. She was a beautiful girl, and she died of colon cancer at 36 years old. I have a friend now that was also in our same graduating year, whose son, 16-year-old son, just died a couple days ago from some kind of sarcoma. 16 years old, just died. And then my wife's co-host, Kate, her good friend, just died a couple days ago from, I think, colon cancer, and he was 39. I mean, like, it's really disturbing to me because these are people's lives being cut short who have an entire life to live and things to teach people and things to learn and expertise to share. And these are lives that are being cut short. And it's just this whole war on cancer that President Nixon started in 1971 with this whole war on cancer. It is just, it's not working. It's not working at all. And so that's why I'm really passionate about helping people find things that are going to help prevent them from cancer. Because ultimately, like I said, it's, cancer, an ounce of prevention is worth a pound of cure, right? So we have to live in such a way that we're preventing these things because, like I was saying in the commercial, simple things like, 5G or dirty electricity in your homes. I mean, these are all things that we're exposed to that we can't feel, we can't sense them. It's like the mold that Dr. Ingels was talking about. We can't see these things. And so if we're going to live in this modern world, it's so important for us to mitigate as best as we possibly can some of these things that are being forced upon us, like 5G. It's being forced upon us. We live in that neighborhood that we're saying, and I look over and they're erecting this huge big cell tower. I'm sure it has something to do with 5G, and it's right. There's a church next to us, and then there's our neighborhood, and then on the other side of the neighborhood is a school. And somehow, I don't know what these companies do, but they sort of co-opted with the church to have this huge big cell tower looming over our neighborhood. And like it's what Dr. Cruz talks about is population density. Last night I was taking a shower and, our home is filled with orange light at night. We don't put on any blue light at night. So, I want to hold on to my melatonin and DHA levels, and I want to, protect my hormones. So we have orange and red light at night, if at all. So, but I'm taking a shower, and our next door neighbor, who's not very far from us, turns on their light, and the whole bathroom where I was taking a shower, all this blue light comes in, and like it's what Dr. Cruz talks about. It's population density. These things are being forced upon us without our will. No one's asking us if we want these things. And so, like with 5G and all these other, things that are being forced upon us, it's imperative that we figure out solutions to mitigating this stuff. The solutions start externally, and then they also continue internally as well. And by internally, I don't just mean physically. I mean taking care of your mitochondria, taking care of your internal environment. Like we're talking with Dr. Ingels just now about the gut health, but I'm talking about like your state of being, your happiness levels, your enjoyment levels, your stress levels, all of these things that impact how our cells replicate. They replicate based on these things. And so when all of those are compromised, it's a bad thing. And then we have external factors too, like the food we eat or like these cell towers and these types of things, mold. So mitigation is going to be a big, I think, word for people. And I think it's going to be, a big part of our lives. We have to learn how to mitigate all of these environmental toxins. And so like, one of the ways that I like to mitigate is through using light therapy. And as you guys know, I have been heavy into research on light. Like I was just saying, if you come over to our house at night, it's going to be all orange and red light, and any kind of indoor lighting that's not red or orange is damaging to your mitochondria. It's damaging to your hormone levels. It's damaging on so many different levels that we don't even realize. And so light therapy sounds woo-woo, and it used to sound woo-woo to me until I started learning the science behind it and start learning how our mitochondrial health is directly impacted by light, primarily through light. It's also through vibration and sound, frequency and voltage, as well as temperature. And these are what impact the mitochondria. The mitochondria are kind of like submarines, sending out radar signals always, always, always to try to figure out what kind of environment we're in. Because it has to know if we're all of a sudden, like we can't talk to our mitochondria and tell it or them that we're flying to Alaska and we're going to be in freezing cold weather. It has to send out frequencies to the environment to figure out what kind of environment it's in so that it can adapt accordingly, right? So that's what the mitochondria do. That's one of the functions that the mitochondria do. Also, create water, create ATP, cause cells to replicate, correctly. All these things, the mitochondria do. And so it's really important to take care of your mitochondria. The best way to take care of it is get out in the sunlight. That's number one. But the problem is that a lot of people can't do that. And so this is why I like this Juve red light therapy. I use it every night. I use it at least 10 minutes a day. Sometimes I'll do 10 minutes in the morning and 10 minutes in the evening. And the cool thing is there's different little models you can get for your light. And now with the new improved models, they have them so that you can put them on your desk. So you can put these anywhere on your desk, and it's really cool. I have mine hanging over my door, kind of like this. Actually, I can show you a picture of me using it if you guys have never seen it. And so that's a picture of me. It's not my door. I have it hanging on the wall, and I stand in front of it just like this. And that is activating. That's pure mitochondrial food, basically, for our mitochondria, this red frequency of light. And so this is why it's so important to make sure to take care of the light environment that you're in. It's so important. And a lot of times we just can't get access to the sun. Really what it's all about is the sun, getting biophotons. That's going to be orders of magnitude better than a Juve. But the issue is getting out in the sun every single day. So this is why I like to supplement the sunlight with red light. So red light is actually the healing part of the light. So the red light is, according to the Juve, it's I think it's 660 to 650 to 860 nanometers. That's where the red light is coming in. So 660 to 850 actually. And this thing will last you 50,000 hours. It's got a 2-year warranty and a 60-day money back guarantee. And it helps to build collagen in the skin. And it's got so many incredible benefits, like repairing damage from the sun if you've been in the sun for too long, or if you want to learn how to hold on to more sunlight. Sometimes I'll preload with red light therapy and then go in the sun to prevent burning. It helps with wound healing. It's anti-aging, reduces joint inflammation. It helps with infertility. It helps muscle recovery and peak performance. As well as with scars, wrinkles, stretch marks, this type of thing. It all helps with this Juve. So make sure to check that out. If you guys want to learn more about bringing this red light frequency and this red light therapy into your house, I'd highly recommend it. As you guys know, it's all about light, water, and magnetism, right? And so that's why I've been big on the Magnetico sleep pad, the Juve, making sure that I'm allowing my body to hold on to more light through using the DHA. But the Magnetico mattress pad, talk about a way to mitigate 5G and wireless radiation. Because basically what you're doing is you're bathing your body, you're bathing your cells in this magnetic energy when you're sleeping. And what's cool about it, like with the Juve, you have to stand in front of it for 10 minutes a day, right? And so it's kind of hard to do. But it's not hard to do, but it's just it takes effort to do, right? But with the Magnetico, it's amazing because all you have to do is sleep on it. You go to sleep anyway. And so, every 50 years, the magnetic decreases in this Magnetico by 6%. So this is like a one-time purchase. Bathing your cells. We did a whole show with Dr. Dean Bonley about how it affects the electrons and the photons and the different frequencies and voltage in your body. It's crazy what it does. And so as Nikola Tesla said, if you want to find the secrets of the universe, think in terms of energy, frequency, and vibration. Right? So here's a picture of Kate. Let me show a picture of Kate sitting on R1 right there. That was just when we were putting it on. And we don't even have the strongest model. We've only got the 10 Gauss. It goes all the way up to 20 Gauss. And for those that don't know, like during the time that the Babylonian Empire was around, the magnetic field of the Earth was 3 to 5 Gauss. Now it's less than 0.5, which is crazy. And some people say that when there's giants roaming the Earth and dinosaurs, the Gauss of the Earth was 300. So studies are also showing that the magnetic field of the Earth has been weakened by over 80% over the last 4,000 years. And so magnetism is inextricably linked to our health, and bringing more magnetism into your life is going to be really, really impactful and helpful as well. So if you want to get a Magnetico mattress pad, I'll put a link in the bio below. But the code to get it is EHR10. That will save you 10%. I'd recommend the Super Sleep system. We're going to be upgrading to that pretty soon. We've been super, super impressed with just the 10 Gauss. So I can't imagine what's going to happen when we go up to the Super Sleep system, which is 20 Gauss. So I just wanted to tell you guys about that. Let's see. Let me check out the chat and see what you guys are talking about. You're an Animal says, those dirty electricity filters are great, but I'm so sensitive that I need the whole local power relay for a good chunk of town to shut down. Then I feel amazing. Happens every time. You know, it's interesting too that you say that. We're so electromagnetic sensitive these days that I'm with you on that one. You know, if you're going to sleep in a room, you should really be mitigating the dirty electricity in the walls with these green wave filters. But if you can sleep outside or closer to nature, Maria says, what's the names of the probiotics he found out were the best? Okay, shoot. I don't know. I'd have to go back. You know what? I have to go back. Maybe if you go back and take a look, I can find out the answer to that question. Let's see. I think after fecal transplant, you still have to work on detoxing the body and helping to ensure microfusion is optimized. Hardly any singular treatment works all by itself. That's true. That's so true. You know, a lot of people are looking for like the magic bullet for these things, for cancer, for Lyme disease. People just want just a single thing, like, oh, I just need to take this. And, you know, it's the body is so incredibly complex. It's much more than that. And so, you know, we really need to take a holistic approach of lifestyle design and changing our environment and changing how we think, how we feel, what we do every day, what we're exposed to, the people we're around, the books we read, the substances we take. You know, if you really want optimal health and you really want to be at your best and live long and healthy, disease-free, like we have to take stock of every single one of these areas of our life and optimize every area of them, because it does no good to be like what I always call the angry vegan, right? The guy who's upset, but he's drinking a green juice. He's mad at everybody else, but he's drinking a green juice. So I've had some early life severe food allergies and asthma. Unfortunately, both of these conditions I no longer suffer with. That's awesome. In San Diego, the microcells and 5G systems are going up like crazy. Really? I've heard that they're putting up towers everywhere with the 5G. See, this is the issue with the 5G, is that one of the things that it's going to be allowing people to do is basically get access to movies and to, you know, media that's streamed and make everything faster and quicker, and so that you could, you know, have self-driving cars and you can do all these amazing things. And I'm all for that. You know, that's great, but not at the detriment to our health, you know, not at the expense of our health. And so unfortunately, the way our society works is just everyone just says, oh, can I download a movie much quicker? Of course. So I'll do whatever I have to do that. He says they're placing these transmitters all through even the least populated zones where have high value properties are and big land plots. I hear them in my head, and the noise is ungodly. If you're lucky, you'll just have ear ringing, but when you can hear the pulse and the tonal notes oscillating and shifting, it's hell. Wow, you must be really sensitive. Yeah, I mean, we're talking about a billion cycles per second of frequencies impacting our cells. And how this affects the cell is crazy, because if you look at the work of Dr. Martin Pall, he talks about the calcium ion channels of the cell. And the cell, inside the cell, the calcium is supposed to be very, very low. And outside of the cell, in the interstitial fluid of your blood, is supposed to be where the calcium is much higher, up to 1,000 times higher. But what's happening is that when these frequencies are oscillating the cells, it's opening these calcium ion channels. And what happens is that the calcium that's in the interstitial fluid, according to Dr. Pall, is now entering into the cell. And it's up to 1,000 times more calcium getting inside the cell than what is supposed to be there. And so that's akin to like blood-brain barriers being diminished, right? And allowing heavy metals to get into the brain. And so what happens as a result of this is over 150 different disease processes happen as a result of too much calcium getting inside the cell. And that's happening as a result of wireless technology, 5G, all this stuff. It's going to be really, really damaging, my friends. And so we need to figure out a way to mitigate this stuff. Listen to our last show that we did with Brian Hoyer. It's on our YouTube channel. You can check it out. And he's a sort of a building biologist. And he talks about creating a Faraday cage in your room using this special paint. And he'll come out to your house and he'll do testing. And he'll test for even geopathic stress, or he'll test for all these different frequencies that, he's got like meters that are like $3,000 meters, and so he'll bring all this equipment to your home and then figure out what kind of electromagnetic field radiation you're exposed to. This stuff is serious. It's much more serious than we know. And I think that one of the issues is that people just want to say, oh, I'll take colostrum to help heal my gut, or I'll take, diatomaceous earth, to help clean parasites out, or, they just want one or two things. But in actuality, it's our lifestyle. It's our body's intelligent response to a toxic environment and toxic lifestyle. That's what's really going on. So your bodies are doing what's actually intelligent for it to do. It's responding accordingly. But no one wants to change their lifestyle, and no one wants to change their environment. So they'd rather just focus on the stuff that's not going to make much of a change at all. And that's like diet, all the stuff. It's good, but it doesn't really change ultimately. What's really the main problem, at least on a physical level, is our environment. Light therapy is on my list. Our tissues are loaded with antenna pigments and many other structures that respond to natural forms of light. Antenna pigments are involved in many kinds of moleculars. Yeah, they call those photoreceptors in the skin and melanopsin in the skin. And there's over, I think, 1,500 different wavelengths of sunlight. So when you're exposed to the sun and you're exposing yourself to the sun, you're getting 1,500 different wavelengths. And Dr. Cruz says there's 10 to the 46 or 10 to the, as if it matters, right? 10 to the 41, 10 to the 46. What's the difference, right? But 10 to the 40 something of different frequencies in the sun. So when we're getting exposed to sunlight, we're not getting just photons. We're getting biophotons. That is photonic energy direct from the source. And that's what helps create ATP, and that's what helps create that voltage in the body that allows our body to run. Like Dr. Jerry Tennant says, healing is voltage. And so that's why it's so important to get out in the sun. And a lot of people are wondering, oh, if I get out in the sun, I might burn, and this, that, and the other. And there's a whole strategy that I can share with you about how to minimize the potential of burning, because really we're light deficient in our environment. We need more light. We definitely need more light. And that's number one. That comes before food. And so that's why I'm so big on things like the Magnetica, which is basically, frequency. It's magnetic frequency, the Juve. But better than the Juve would be just go out in the sun. That's even better. The Juve is great because it helps if you're busy and you can't get out in the sun every day, or have seasonal effectiveness disorder or stuff like that. It's great to have this stuff inside your house, but ultimately, it doesn't substitute for the sun. And so the sun is where we derive our entire life. We need access to those biophotons in 1,500 different wavelengths. It's how we understand our environment. And so What's strange is I look very young for my age and generally healthy. Nobody would suspect I suffer from hypersensitivity. Wow. Oh, Maria says that you already checked on his products. Okay, cool. Maybe he has those on his website. Miguel says, what about water? What kind of water do you drink? There's a lot of people that say different things about water, and a lot of people I think water is such a complex subject. I really honestly don't think anyone on this planet Earth knows what it actually is and why it's better than other water. So water is so complex. There's so much going on with water, yet we need it. We need it to live, right? Our body needs water to live. So everyone has an opinion, and there's a million different types of water out there. What I suggest you do is do your own research and try to find the best water you possibly can. With that said, we used to go to a well, or not a well, a spring, and collect. We have like 6 or 7 6.5 gallon glass carboys that we bought. And we'd go out to a spring like once every couple months and just fill up. That spring subsequently got shut down. And then we started going to a well, which well water, in my understanding, and I'm just going to say in my understanding when it comes to water, because water is so complex, I don't believe anyone when they talk about water. I know so little about water myself that I'm just doing the best I can, and I think that's what we all should do, right? But from my understanding, well water is premature water. And it makes sense, right? Because you have this water in the aquifers that hasn't used levitational energy and cosmic forces to spiral up through the crust of the earth yet, right? So it's almost like incubating. And so it's like a pregnant mother at 5 months old. The baby's not done baking yet, right? So well water is essentially, from my understanding, a premature water. So a lot of times it could be contaminated with high levels of calcium because that stuff hasn't been filtered yet through the bedrock of the crust of the earth as it spirals upwards against gravity. So all of that is an issue with well water. Now some people are saying when it comes to spring water is loaded with acids. But I would have to test all of the spring water in the whole world to know that, right? People say that, make grandiose claims and generalizations, not knowing that you would have to know and have access to testing all the water on the earth to say that all springs are like that, right? But I have heard people say that spring water is loaded with too much acid rain and acid from the environment. And these acids, if you look on Google Images, like if you type in acid rain statues, you'll see these huge stone statues just being eroded away by the acids that are in rainwater. So the question is, do those acids affect us internally in the way that we think that they probably do? The answer is probably yes. So with that said, if well water is premature water, spring water is filled with acids, just surmising here, maybe this is the case, maybe not. If those two are true, then what are we left with? Well, then we're left with bottled water. The issue with bottled water is filled with plastic, right? And we don't really want to support bottled water industry. They're just basically taking municipal water and putting it in plastic, which is even worse than just drinking it right out of the tap. So what are we left with? We're left with basically tap water. Well, I guess you can condense water as water condensers, water distillers, stuff like that. What we do is we use the Omica Organics 12-stage reverse osmosis water filtration system. We really like it so far. We've had it for a little over a year, and because we like it so much, we put it in our store, and we really like that particular water system. So we have a full system. When it comes to water, I don't really trust anybody, to be honest with you. I don't trust any one product. I don't trust any one person when it comes to water. I'm suspect of it all because I don't think that anyone really knows what they're talking about when it comes to water. So what we do is we have a structuring whole house filter that we have that's in our store. It's the one from, what's it called? The Wellness Enterprise. We've had Patrick Durkin on our show. So we have a structuring device, water coming in to the house. Then it goes through the Omica 12-stage reverse osmosis. Then we take it out of that, and then we put it into a Berkey system. and then we take that final water and then we put it into a structuring device and structure the water. And then I take that and then I make our ice cubes out of the Omica as well. And so that's our current water setup. There's obviously ways to improve it. And so there's a lot of things that we can do to improve our water. But you know what? Ultimately, it comes down to just being okay with the water you're drinking and just saying blessings to it and praying over it. All of these things are helpful. Yeah, I've heard about Willard water as well. You can add a little bit of Willard water and essentially make it last forever. You pour a little bit of Willard water, Willard, and it helps to structure the water apparently. Various kinds of water to balance out any less than desirable qualities, and then some pink salt. Yeah, it's a good idea. Just do the best you can with your water. I'm partial to the Omica just because we've had it for a year and we've tested it and we really like it. It's an incredible system, but do your best with water. In my opinion, water, although we don't know much about it, I really don't believe that, even the experts we've had on our show understand fully what water really is. I was just learning about something recently about a solid state of water at room temperature. It's called, what is it called? It's called double helix water. I don't know everyone has these claims, right? Can you imagine a solid state of water at room temperature? And this double helix water apparently is great for all these different things. I just don't think that anyone really has a clear understanding of what's really going on with water. So do the best you can. People are going to make claims. People are going to say this, that, and the other. Just do the best you can. At some point, you just sort of do what you can, and then you let the chips fall where they may, and let God take care of the rest, right? Bless the water, bless the food, be happy, drink it in the sun, and you're going to be fine. Willard water, from my understanding, super high quality RO filters seems very promising. But then we use, like I said, this Omica, right? 12 stage. It's actually beyond 12 stage. So it filters out everything. And it also remineralizes too. People think that ROs, because it's RO, it's got no minerals, but the Omica remineralizes. So that's why it's beyond RO. But it's just there's just so much going on. Just do the best you can. There's a fourth phase of water. That's right. That's the work of Dr. Gerald Pollack, The Fourth Phase of Water, which is a book he wrote. So, at some point, all of us have to be okay with picking a water system that we're comfortable with and we feel good about, and just going for it, and then if you don't like it after a couple of years, just get something else. We've had Dr. Pollack on our show. Yeah, it's called Easy Water. Yeah. Fourth phase of water. And so ultimately it comes down to just doing the best you can. If you don't have, the Omica in terms of price is actually one of the cheapest. Rafi, the owner over there, I was talking to him on the phone a while back, and he's conflicted about, he should be charging a lot more for the actual complexity of the setup of the Omica, but he also wants to make it available for people. But if money is an issue, then go get Mountain Valley spring water at the store, in glass. Just do your best, and don't obsess over it. A lot of people obsess over water. We had Gerald Pollack on the show. He's a cool guy. Really, really cool guy. If you guys have any questions for me, if you guys want to ask me any questions about maybe the Extreme Health Academy or any of the things that I do for my own health or anything like that, I'm here for another couple more minutes if you guys want to ask any questions. And I'll be primarily just manning the chat on our YouTube channel. That way it makes it much easier for me to see all the different comments coming in and stuff like that. Did want to give you an update. We have William Pollack, not Gerald Pollack. We've got William Pollack coming up on Friday. We're going to be talking with him about PEMF therapy, pulsed electromagnetic field therapy, which is something I do every day. I have a SOTA machine. SOTA. I have their magnetic pulsar that I use. I usually use that when I'm on standing in front of the Juve light, actually. So I combined biohacks there. And then I have the IRMRS 2000 mat too, which is available in our store if you guys want to check that out. But we'll be talking with him about PEMF and what it does. Pulsed electromagnetic field therapy. Amy Prohl is going to be on Monday. That's going to be a cool show. We're going to be talking with her about the Marshall Protocol, and the microbiome. And if you have any gut issues, I mean, she's a real scientist. She was someone who was on death's door as a result of Lyme disease, actually. So we'll talk to her about that as well. But she used the Marshall Protocol in her Lyme recovery. And then we got Mark Wolin. We're talking with him about family constellation therapy. And you guys, if you don't know anything about family constellation therapy, the idea that our nervous system downloads past traumas from the previous 3 generations and the next 3 generations, and family constellation is a really interesting spiritual connection to our physical health. So make sure to check that out. And then we have Yarrow Willard. We'll be talking about medicinal mushrooms and why they're so important to bring into your body for improving immune system, preventing disease. If you guys aren't on reishi and chaga at the very least, you need to buy some reishi mushroom and chaga mushroom and start getting on the medicinal mushroom path. Super, super important for overall health, longevity, immune system, and energy production. Mushrooms are critical for our health. So so those are the shows coming up. And also I wanted to tell you guys too, I have no financial stake in this, but there's a device called the AMP Coil it's called AMPCOIL, and they're using it for Lyme disease, a lot of people now. So it's really, really impressive. So it's a combination of Rife technology and PEMF therapy all together in one. So something you may want to consider if you're looking at different options for Lyme disease, and the Marshall Protocol as well as Dr. Darin Ingels' book. We've done quite a few shows on on Lyme disease. So if you guys want to check those out, they're available at extremehealthradio.com. Is there anything else? Make sure to go over to, let me put a link here, to go over to The Truth About Cancer. Guys, sign up for this, please. Please, please, please sign up for The Truth About Cancer. It's coming up. You don't want to miss it. The amount of information Ty puts into this thing is incredible. And, it's empowering information that will help people prevent and heal from cancer without chemotherapy. I'm not going to say a cure because nothing can cure except for chemotherapy, radiation, and surgery, right? Only doctors can cure people. Oh, man. Can't believe we even have to say that. So anyway, thank you guys for your support. Ron says here, turmeric with small amount of black pepper. Black pepper makes turmeric 2,000 times stronger. You can put this in your tea. That's true. Thanks, Ron, for that. My husband does this every day, says Sherry, but adds coconut oil unrefined as well. My husband and I both suffer from chronic pain. Well, Janet, I'm wondering if you've been tested for anything with regards to chronic pain. CBD is always an option. Yeah. A lot of people chatting in the chat room. So you guys are amazing. Thank you so much. Make sure to subscribe to our YouTube channel if you haven't already subscribed. That way if you click, there's a little bell somewhere. If you click on a bell, I've heard that it will notify you when we do go live. So that way you can stay up to date on all the shows we have going on. The cure is in the knife, totally nonviolent. The cure is in the knife. Are you being facetious? Or are you saying surgery is what cures? You're an animal. That's awesome. A lot of people talking. This is great. All right, guys. Thank you again so much. We love you very, very much. Let me bring up our little legal disclaimer. Bring that up. Stay tuned for our show this Friday on PEMF therapy. That's going to be a cool one, so make sure to check that out. Again, we love you very, very much. Let us know if we can ever help, and we'll catch you guys on the next episode.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog or to start any health program without first consulting a health professional. The content found here is for informational purposes only and is in no way intended as medical advice, as a substitute for medical counseling, or as a treatment/cure for any disease or health condition, and nor should it be continued as such. Always work with a qualified healthcare professional before making any changes to your diet, prescription drug use, lifestyle, or exercise activities. This information is provided as is, and the reader/viewer assumes all risks from the use, non-use, or misuse